I hope to see someday somebody doing a very accurate and effective nerve block in space. I'm Jon Bailey. I'm an anesthesiologist here in Halifax. I specialize in acute pain medicine and regional anesthesia, which means putting local anesthetic beside a nerve in order to create an area of numbness on the body. And today we're here to test some of those techniques for use in space. So the end goal of this research ultimately is to have a fall-safe plan for astronauts. Pain control is not only important in terms of their experience if they're injured, but also in terms of safety for the crew, because pain does have a variety of negative consequences on the body. Okay, so we're going to do our first of a couple of tests today. So we're just going to load all our gear up, do a quick safety check before we go, make sure we have all of our gear, and then underwater. Underwater is similar to a space-like environment in that we're floating, the patient's floating, and our gear is floating. So this is more similar to low Earth orbit on the International Space Station. It's dissimilar in that we can't talk to each other, so we have to use hand signals, and we're looking through goggles most of the time. So it's not perfect, but it is good.
I'll give it looks good.
Okay.
You lift the figure, I'll inject.
Oh, okay.
So there are many limitations to pain management in space right now. There's a few things that are a problem. So any pain medication that you take orally or by injection, that it works on the whole body, is sedating at the least, and at the worst could cause confusion or impairment of cognitive function, which could really impair mission safety. So this is the model setup. We've got Buddy here as our patient, and that's where our meat models come in. So we have tendon to simulate nerve and beef to simulate muscle, and then encapsulate that all in ballistics gel to keep it clean so that nobody minds about us taking fresh meat into a pool. So the equipment involved in this is an ultrasound, and then we use a small needle that is echogenic, means that it's bright on ultrasound, and then place that and we inject what's a simulated local anesthetics. It's actually just dyed fluid to see where the needle is and whether it's accurate. So you're going to go nice and slow. I can now see the needle beside the nerve, so then I would indicate to inject some local anesthetic, and I would make sure that I see on the screen that pool of local anesthetic going around the nerve that I'm trying to block. Once that's done, the needle comes out and that's it. The first study we had experts doing this, but very likely we're not going to be chosen as astronauts, unfortunately. It's going to be somebody that meets all the other criteria, and then we'll be taught to do these procedures. So our next step is to bring in people that are very good divers, so that takes that out of the equation, but aren't familiar yet with nerve blocks, but we'll see whether they can do it with the same accuracy that we can.